Karen, hello.
Hello.
Could you start by introducing yourself to all the people that are going to see this?
Yes, sure. So I'm Karen Curtis and I'm the lead coach with Medway Community Healthcare. And I've been a part of the project since the beginning, back in 2017.
And the project you're talking about is the Transforming Integrated Care in the Community project.
It is indeed.
In which Medway Community Health has been a partner. And what's been the best thing about that for you?
I think the best thing is about looking at how we empower our staff, but also about changing the way patients look at their own health and empowering them. So giving back autonomy to our clinicians, and as a clinician myself, it's an honour to be a nurse, but it's about supporting our communities back to health and utilising the resources we have around us and giving them the tools to enable them to do that.
Okay, thank you very much. That's great. And what's been the biggest challenge for you about going about that?
The biggest challenge is about getting people on board. So a lot of people don't like self-management, or the thoughts of being self-management. That hierarchical structure has been so embedded into healthcare settings. So it's about changing that culture. And I think once we get over that and we look at how that supports their delivery of care, I think that's the big, although it's a challenge, it's a big success as well.
Thank you. And final question, what's been the most difficult thing? In other words, if there's one thing you know now through 4 years of this experience, and 2 of those years have been the COVID years, but if there's one thing you've learned in that time that you would make you do something differently from the start, what would that be?
I think for our organisation it would be doing the back office at the same time as rolling out the pilot teams and learning from those lessons of what is needed from our back office, but also what is needed from our clinicians, and making sure that they're aligned so that we're not putting too much pressure on the clinicians, but also not putting too much pressure on the back office, having it work in silo rather than this is your job, this is your job. We need that more continuity between the two.
Thank you very much, Karen.
You're welcome.